Good afternoon, everyone, and welcome to our last GLPP and Minnesota HIIN Sustainability webinar. A few housekeeping announcements before we get started. All lines will be muted. For those of you using PC audio, we ask that you please mute your lines throughout the presentation due to additional noise feedback that may occur. We also ask that all phone lines be muted. Throughout the discussion and during the Q&A portion, feel free to use the questions panel on the right side of your screen. Additionally, this session will be recorded and we'll post the recording and slides on the MHA community site, as well as our YouTube page. If you have any additional questions outside of the webinar, please email keystone@mha.org. With that said, it's my pleasure to hand it over to Ann Allen from the Wisconsin Hospital Association.
Thank you, Naomi. Today's topic is on pressure injury reduction, and one improvement activity that we did in Wisconsin that I'm really excited to share with you all today is pressure injury reduction site visits. Our pressure injury reduction site visits featured an in-person visit from Kathleen Bowman, who is a clinical nurse specialist and consultant out of Michigan. During her site visits, agenda items included briefings with hospital leadership, unit rounding on multiple units, and education sessions with staff. And a review of internal and external data was conducted both prior to the visits, during the visits, and after the visits. Hospital participants received a formal written report with recommendations after the visit, virtual support via phone and email from both the Hospital Association and Kathleen, and then a 6-month follow-up virtual visit was conducted in Wisconsin to assess progress and assist with initiatives. These site visits were fast-paced, jam-packed days full of tailored recommendations specific to the organization and unit. Hospitals in Wisconsin received 1 day on-site, and Michigan hospitals received at least 2 days on-site with Kathleen. Some of the education provided by Kathleen during the visits was on patient hygiene, incontinence-associated dermatitis and suspect pressure injuries, including clarification and definitions, diagnosis and differential diagnosis, prevention of IAD and HAPI, pressure and shear risk factors, body positioning and mobility, and prevention strategies. Some common recommendations that came across in multiple site visits included development of a wound care program, wound ostomy and continence certification for nurses, sharing of that nurse's time between clinic and hospital in order to maximize resources, internal data reviews, confirming present upon admission and accuracy of coding, providing 2 eyes assessments upon admission, bathing and incontinence, lots of changes in products and standardization of procedures. Multiple units were found to have a wide array of products available that resulted in inconsistent use and incorrect positioning of use. There was also removal and or replacement of products. Another common theme was changing out removable pads with disposable pads. Mobility and turning. What was found was that TAP systems were not being used on med-surg. They were only being used in the ICUs. So a recommendation was made to conduct training and education on the med-surg units and then transfer those TAP systems with the patient when they were discharged from the ICU to the med-surg unit. Use of wedges, heel protectors, early mobility through ceiling lifts, and removing extra pillows on units to discourage use. Pressure injury huddles should be conducted whenever a pressure injury is found and use learn from a defect tool. Many hospitals already had skin champion teams in place, but ensuring that there was staff involved from all levels, from staff nurses to CNAs involvement was key. And just to share with you some results, action plans that evolved from these site visits included implementation of incontinence-associated dermatitis assessments, huddle tools, heel protection decision trees, use of a Braden subscale within the EMR, removal of usable pads from units, sacral dressings, use of wedges instead of pillows, and education program revamps from the education department. The performance data shown is representative of one large urban level 1 trauma facility who saw an almost 40% improvement from baseline from the time that they had the site visits to 2 years later. And with that, I will hand it over to Joshua Swire with the Michigan Health and Hospital Association. He's a senior manager, safety and quality, and will share some Michigan-based resources with you.
Thank you, Annie. Good afternoon, everyone. My name is Josh Swire, and I am with the Michigan Hospital Association Keystone Center. Let's see if I have rights to change screens here. Naomi, could you give me rights to change screens?
You have rights now.
Thank you. Okay, so Ann provided us a nice overview on the pressure injury site visit work we conducted here in Michigan. And to expand on that, I'm going to review the pressure injury resource guide that evolved from that work. This guide is available to everybody for your use in your efforts to continued improvements in the prevention and treatment of pressure injuries. So in follow-up to the pressure injury site visits, the MHA Keystone Center wanted to develop a way to spread the lessons learned from the site visits as part of a larger dissemination plan. Utilizing our direct observations and post-site visit reports, we were able to identify common themes and create this resource for all members to use. It's important to note that this is not necessarily intended to be a comprehensive guide to reducing pressure injuries, but more so a high-level overview of what we identified as the crucial elements of a successful pressure injury reduction program. You can use this tool to either conduct a comprehensive review of your current program or perform a deeper dive into the 6 crucial elements outlined here in the slide. On the next slide, I'll go over those 6 elements and provide an overview of what is contained within each. Just as a reminder, as with all the sustainability webinars in this series, these slides will be posted on the MHA community site, and the link to download this guide will be available for you. Okay, so this is the first page of the pressure injury resource guide, and it provides a visual depiction of the 6 crucial elements of a successful pressure injury program. If anybody also attended our sepsis webinar, it's set up much of the same way. The subsequent information provided in the document provides a more in-depth explanation of the importance of each of these topics, as well as a variety of credible resources that organizations can review and reference. So just real quick, I'll go through these 6 crucial elements. The first being repositioning and turning patients every 2 hours and educating patients and caregivers on the importance of turning, performing regular internal turning audits, collecting that data, establishing your baseline performance, and then using that data to measure ongoing improvement. So that's that first crucial element. Next is the appropriate use of pressure relief devices. And this provides an overview of recommended devices that should be used for positioning and how to use them. Next, education and prevention, recommendations for incorporating the use of wound ostomy and continence nurses in your wound program and training topics for staff. Reviewing the risk assessment, and this area really goes through the various risk assessments that are available for you to use, and then the focus on the importance of implementing patient-specific interventions to prevent and treat pressure injuries. Next is moisture, and that is a fundamental overview of the importance of keeping patient's skin clean and dry. And then the last crucial element is recognizing the importance of multidisciplinary teams and engaging various members of various teams to prevent pressure injuries. If anyone has any questions on this guide, please chat them in and we will review them at the end of the presentation. With that, thank you for taking the time out of your day to learn more about this resource, and I will hand the presentation over to my colleagues in Illinois.
All right. Thanks, Josh, for that. Hi, everyone. My name is Jenny Winkler. I work at the Illinois Health and Hospital Association, and so today I want to share a handful of resources with you guys that you can use, in your quality improvement and your reduction of pressure injuries in your facility. So the first one I want to start with is something that we call our starter pack. So it's part of our GLPP HIIN work. We had developed a handful of resources that we call starter packs. And the intention of these resources was really just to give you a jumping off point, somewhere you can start working on your improvement efforts. So these starter packs were developed by national and local subject matter experts, and were developed for each of the topic areas that were focused on during the HIIN program. So in each of these starter packs is included, there's webinars that are included that have best practices specific to each one of the topic areas. There's also a handful of resources that will walk you through some of the quality improvement basics, and specifically with how to implement interventions and small tests of change, to impact your quality improvement work. So there's some specific design plans in here that will help you lay out your small tests of change in your different interventions. And there's also a gap analysis tool included in these starter packs that will help you walk through the different practices that you already have in place in your organization, and then help guide you and identify where you might want to start focusing your improvement efforts. So there's a link to IHE's website at the bottom of the slide, and it'll take you to the spot on our website where you can find the starter pack resources for each one of these topic areas, including reducing pressure injuries in your facilities. And so with that leads me to the next set of resources that I want to share with you. But before we jump in too far, I kind of want to give you a little bit of background where these resources came from. So again, over our HIIN program, we had hosted a handful of safety sessions, and safety sessions were large meetings where healthcare providers could come together and they would learn from subject matter experts, but they would also have opportunities to learn from their peers. And so these safety sessions were great opportunities for hospitals to network, really dig in and share those best practices, and to ask questions and learn from one another. And so over the HIIN period, we hosted 2 safety sessions that focused on pressure injuries. And so I'm going to show you 2 of the resources that came from those sessions that we felt were really, really helpful. And then, for your reference, the link at the bottom of this slide takes you to our website where you can listen to the recordings and access presentations from all of the safety sessions that we had done over the HIIN program, including the pressure injury ones. So with that, the first tool I want to share with you is our process discovery tool. And so this might look familiar to many of you because we've used these tools for a handful of the other topic areas in our HIIN work. And what's really great about these is that you're able to do retrospective chart review to really hone in on the processes that you have in place, and then again, start identifying where some of your gaps might be. So, a little slow. The next slide is a screenshot of the process discovery tool that is specific for pressure injuries. And there's a link at the bottom of the slide where you can click on this and download the tool. And the way that this works is that you review 5 to 10 charts of your most recent patients that had a stage 2 or a stage 3 hospital-acquired pressure injury. And then when you're looking at those charts, you're going to be digging into the documentation for 3 days prior to the discovery of that pressure injury, and then 3 days after the discovery of injury. And so, when you're looking at this slide, on the left-hand side of the tool, I apologize, I know it's a little small to see, but you can see there's a variety of statements, and then that reference a step in your process. And so what you do is you move through the tool, and you can indicate on this tool what steps of the process were completed and what weren't completed based on your chart review. And then as you move through this tool, you can start to see, the trends, of what processes you have in place, where some of the failures might be. And then again, in conjunction with some of your gap analysis and some of your other tools, you can really use this to determine where you want to start focus on your improvement processes. So the next slide is a close-up of all of the different statements that are included on this tool. It's a 2-page tool. And so you can see there's a variety of the process steps that are involved when it comes to preventing pressure injuries. So it's a pretty comprehensive tool. It's a really great place to start. The second tool is that I want to share with you is this action planning tool. And so this is something that you can use in conjunction with that process discovery tool to help, again, with outlining your implementation strategy. And so, this action planning tool is based on the model for improvement, which is an evidence-based strategy, of course, for quality, for approaching quality improvement work. And it's really great because it helps you break down those interventions or action items that you might want to start focusing on into actionable steps. And so the goal of this action planning document is to have a blueprint, something that you can start with and always continue to refer back to. The idea behind these action planning documents is it's something that you can make changes to and tweaks to as you're moving through the improvement process. So it's really a great place to start and something, that you can have for your whole team to reference. So here's a screenshot of what the action planning document looks like. Again, there's a link at the bottom so you can download this document to use. And so, as I just mentioned, when you're looking at this, you can see it takes you through those different pieces of the model for improvement. And so, you start, when you're approaching this, you start, of course, by identifying and developing your aim statement, which is really what you're trying to accomplish. That's that specific goal, that you're trying to reach with your intervention. And then you move into developing the measurement piece. And this is where you define, what you're going to measure to determine if your intervention is having an impact, whether, and it's important whether it shows improvement or not. And so, thinking through the measurement piece and what data you have available in your organization, that's where you'll start to document this here. And then the last piece of this document is where you map out your test of change. And this is where you'll lay out the different changes or the different tweaks that you want to make to your current workflows and processes. And then I know many of you've heard of PDSA cycles, the plan, do, study, act cycles. So this is where you'll start to break out the different pieces of the PDSA cycle. So you'll think about what exactly you want to change, what processes you want to have in place, then who is going to be responsible for those small tests of change, And then you're going to do the study piece where you're going to be tracking those changes over time. And then in the last column, is your determination of whether or not that change or that intervention you put into place was meaningful, what your next steps will be. Will you continue? Will you make tweaks? Will you make changes to those processes, et cetera? So I realized that is a very simplistic and very high level overview of how you would complete this. But if you have any questions about action planning or how to use the model for improvement, I really, really encourage you to reach out to somebody at your state hospital association, and then they can work with you to provide additional support or assistance with any of your efforts with action planning or any of the work you're doing to impact pressure injuries. And so those are just a handful of our resources. And so with that, I'm going to go ahead and turn things over to Jenny Schonecker at the Minnesota Hospital Association to talk about their work.
Great, thanks, Jenny. Hello, this is Jenny Schonecker, and I am with the Minnesota Hospital Association. And I'll talk a little bit about some of the work Minnesota has been doing on pressure injury prevention. So I'll go over the pressure injury roadmap with you and just do a high-level overview of that. I'll show you a patient education tool that we've developed, and then also go over a couple of our pressure injury committee resources. So here's a list of some of the things we've been focusing on the last year. And I'll go into some of these in more detail, but I want to just review each of them real quickly so you know what resources are available on our website. The first is the pressure injury roadmap, which we have updated recently, and the roadmap does include a medical device toolkit. So I'd encourage you to check that out. That's really helpful on pressure injury prevention related to medical devices. We also have the patient and family education flyer, which I mentioned, and I'll go over in more detail, as well as orientation modules for staff on pressure injury prevention, and I'll talk about that a little bit more in a bit here. We also have on the cusp pressure injury cohorts, which were really focused on pressure injury prevention, and the cohorts were really worked closely together to work through the cusp process and monitor their pressure injuries, and we saw some really good results come out of that. We hosted a falls and pressure injury conference, and we decided to do these two topics together in one conference because of the overlap falls and pressure injury have with each other. And so it gave a really good perspective on fall and pressure injury prevention and how they intersect, and initiatives that can be in place to help both falls and pressure injury prevention. And so videos of that conference are online on our website. We also have a head-to-toe skin inspection video available, a support surface gap analysis tool. I'll talk a little bit more about this. And then what we have found to be really helpful as well is subject matter expert site visits and phone consultations. So before COVID, we had in-person site visits with a subject matter expert in person for a day or a day and a half, really getting familiar with the pressure injury programs in certain hospitals. And then that would turn into some recommendations and ongoing communication about the different recommendations that subject matter expert gave. So that has been a really good resource to be able to offer, having that subject matter expert. The Minnesota Hospital Association Quality and Safety team, we perform as navigators for our hospitals. And so we do reach out to hospitals that have higher rates of pressure injuries, and we review data first of all, and then we talk about different interventions and talk through any barriers they're experiencing. Sometimes we find that the data is not accurate, and there's a coding issue or reporting issue, And so it's been really helpful just to talk through and start at ground zero with that, looking at data and then going from there. We also look at adverse health events that occur across the state, and we're able to look at strong and weak corrective action plans for those adverse health events. And then we're also able to see the common comorbidities that are linked to pressure injuries, so we can identify which of those comorbidities really play into the development of pressure injuries. So here is just a couple images of some of the tools I'll review more closely with you. It's a pressure injury roadmap image, also an image of the patient education tool, the orientation modules, and the support surface gap analysis toolkit. So I'll talk about these in a little bit more detail here. Whoops. I think I just clicked out of the slideshow somehow. Thank you. All right, so the roadmap. We've talked about roadmaps on these calls before, but as a reminder, the roadmaps are evidence-based recommendations and standards for the development of topic-specific prevention and quality improvement programs, and these are intended to align process improvement with outcome data. So this is a screenshot of our pressure injury roadmap. There's many different sections in the roadmap, which include team coordination and approach, accurate reporting tools, staff education, as well as patient and family engagement, risk assessment, minimizing shear and friction, as well as recommendations for pressure injury prevention in the operating room. So the MHA Pressure Injury Committee members oversee this roadmap. They created it, they oversee it, they monitor participation with it. And then they determine which resources might be helpful to include in the roadmap, and just review the roadmap on an ongoing basis to make sure it is current with evidence-based standards. Next is the support surface gap analysis toolkit. So this toolkit is for evaluating support surfaces within a hospital or health system. It is a working document, and it's separated into various components that the team should consider when making support surface decisions. Again, the Pressure Injury Committee at the Hospital Association created this, and it's a resource that's helpful to help hospitals track, replace, and repair support surfaces. We also have data that's collected through our patient safety registry, which houses our adverse health events. And this that data has helped us really track different events that are aligned with inadequate support surfaces. So we've taken those learnings from those events as well and incorporated that into the support surface gap analysis and toolkit. Orientation modules, so these were created by the committee as well, and these walk through what a pressure injury is, different stages of a pressure injury, data collection for pressure injuries, medical devices, etc. There's many different topics, but it's meant for general and nursing staff that are new to your organization to be able to watch these upon hire during orientation, just to get them familiar with their pressure injury basics. And so these are available for any of our anyone that's interested to use these however they see fit within their own organizations. And then finally, the patient and family education. So this is a just a one-pager that talks through some of the important aspects that you would want your patients and families to know about pressure injury prevention. So you can see it talks about what is a pressure injury, how does a pressure injury form? What does a pressure injury look like? And then it goes through the different sections of inspecting for a pressure injury, how your diet and nutrition impact your ability to fight off pressure injuries, talks about how moving helps prevent pressure injuries, also your support surfaces and devices, talks about repositioning and the importance of that, and why it's important that we are doing what we can to prevent pressure injuries. We did bring this to our Minnesota Hospital Association PFAC, and they had some really good recommendations on different words to use so that patients can really understand what is being asked of them and what they're learning through this one-pager. We also translated this document into 4 different languages, and we collect REL data. So we looked at that data to see which were our more common languages, and got input from our pressure injury committee members. And so we do have this available on the site in English, Spanish, Somali, and Mutton. So that is there for anyone that might be interested in using this. And thank you for the opportunity to talk a little bit about the Minnesota pressure injury interventions, and I'm happy to answer any questions. And I'll turn it back over to Naomi.
Thank you, Jenny. So we can go through any questions that anyone has. So we have one question, and they were asking, what is intersect of falls and HIIN?
That might be for me, the intersect between falls and pressure injury. What we have found is that it's important to get patients up and moving, but at the same time, they might be at a falls risk. So how do you manage those patients that that are at risk for developing a pressure injury and could benefit from getting up and moving about, but are also at a falls risk? So talking about different interventions and ways to be assessing for both of those things to decide on what benefits patient most and hopefully prevent both falls and pressure injuries. We also talked about nutrition and the importance that plays in both pressure injury prevention and fall prevention. So there's a few different topics, and those are on our website, different modules from that conference on some of those specific topics that cover both falls and pressure injury prevention.
Thank you, Jenny. So another question that came through, they're stating, so we've learned that as we involve providers more in pressure injury prevention efforts, there is an increase in pressure injuries that appear in our coded data. Knowing that provider documentation is the precursor to a pressure injury ending up in the coded data, and with the knowledge that nursing documentation of pressure injuries is far more frequent than provider documentation, is there anything going on at the national/regional level to close the gap?
Yeah, that's a question that kind of goes along with lots of these initiatives. Even sepsis, you know, when we started sepsis work several years ago and started providing education on severe sepsis and septic shock, and we start seeing more documentation of that, then sometimes it ends up starting the clock or restarting the clock to initiate the bundles, in which we have to kind of look at those processes and how do we come together and provide re-education on you know, appropriate documentation. I can say that I am not currently aware of any national or regional like new ruling that's coming out on the difference between charting a pressure ulcer, because charting the accuracy of whether this truly is a pressure injury or another type of injury. But yeah, that is absolutely it's a gap, and it's something that we need to work on, we need to address. I don't know if any of my other colleagues have anything to add on that, but that's definitely something that in almost all of these metrics we've had some difficulty in.
I think I would just add to that, Josh, that kind of highlights the importance of the documentation of present upon admission. And that's where the 2 eyes assessment technique comes into play, is, making sure that there's 2 nurses upon every single admission, doing a head to toe skin assessment and doing individual documentation, so that you really know that your presence upon admission is documented appropriately.
Yeah, yep, that's a great point. Also, I would definitely encourage this question to be posted in the MHA community discussion board. The majority of hospitals, at least in Michigan, do collaborate on that, and yeah, we might be able to come together and get a little more information.
Are there any other questions? And if you could write your question in the questions panel. Well, I don't see any more questions coming through. Are there any last minute items that our presenters would like to speak to?
I would just like to, thank everybody for, this is our last sustainability webinar, and I hope that everybody found them meaningful while we are in this gap period. And I'm really, really looking forward to hopefully carrying on this great work in the future.
Yeah, thank you, Josh. So if there are no more questions, we would like to just give a big thank you to everyone who has joined into our sustainability webinar series. Over the past 3 years, we have accomplished so much, and we hope that you know that this work does not stop here, and we are here to continue to support you in your quality efforts, and we hope that you stay tuned for future work that is coming down the pipeline. Upcoming opportunities, if you are interested and have not already, we encourage you to sign up for our sepsis Twitter chat, as well as on October 1st, MHA is partnering with HMS for a sepsis symposium, which is open to everyone. And as I stated in the beginning of today's call, resources for all sustainability webinars are located on the MHA community site, as well as webinar recordings on the MHA YouTube channel. If you have any questions, please don't hesitate to reach out to keystone@mha.org or to your state's hospital association. And again, we would like to thank you for participating in today's call and remind you we are here for you, and stay safe, everyone.
Thanks, everybody.